Good evening, everyone. This is Chris here. Good to speak to you again. This week I'm going to be replying more or less exclusively to Jenny in Aberdeen. Well done, Jen. You go Aberdeen. The reason for that being, well, frankly, she's the only one who sent anything in. So let's start off, shall we? Well, Jen, you do express some doubt that that poverty is a risk factor, is a strong risk factor for heart disease, on the grounds that in where you work you see lots of directors and lots of relatively wealthy people who are admitted with coronary artery disease. Now, it's not my case that people with wealth get and die from coronary artery disease, but the big figures, the really big figures, are among the poor. The heart stats from the British Heart Foundation, the maps which I put on the slides, I believe, point to a really strong south-north divide on this subject. And even within Liverpool, my own area, the areas which produce the highest death rate are areas which are poor. It seems to me to be undeniable. And what's more, all the rest of the risk factors for heart disease, your smoking, your poor diet, your stressful living, that sort of thing, they all seem to lean more on poor people than on rich people. Certainly where I grew up, it's easier to get a packet of ciggies than it is to get a green pepper. Now, I think that the reason why poverty isn't mentioned more as a risk factor for coronary artery disease is that it points at different solutions. It's not about making people change their own living habits and all that stuff. It's about changing public policy. It's about making sure that children aren't born into poor families. It's about abolishing child poverty, and that really is a serious situation. Smoke less fags is relatively straightforward compared to that. That's my own personal theory. But I don't know if you looked up the Barker hypothesis, by the way, Jen. But in the Barker hypothesis suggests that if you are born with a low birth weight, then your chances of developing hypertension, diabetes, and cardiac disease later on in life is much more elevated than if you're born at normal weight. And the argument runs that low birth weight babies are going to be babies who are born to poor families. I think really that the evidence is pretty much in on this. The National Service Framework, the National Service Framework, for instance, points to reducing inequalities in health by reducing inequalities in income. And if that isn't recognition of this as a phenomenon, then I don't know what is. But it's not the first one out of students' mouths, I've got to tell you. No student doctors neither. This is the risk factor that dare not speak its name. But anyway, the other thing that Jenny sent me is a question that I asked about Levine's sign. And this is about the characteristic gestures that people make when they are describing heart pain. People, when they're describing myocardial pain, do not, by and large, do this. Oh, I've got a pain there. That's where the pain is. Pretty much they don't do that. What they want to do, what they get an instinct to do, is to do that. Is to press as though the pain is diffuse and spreads and general. It's not the local pain of something which is stabbing and intense. It's got crushing. It's got vice-like. Levine's sign. And clenched fist over the centre of the chest conveys a gripping central, and a flat hand over the chest conveys crushing heaviness. Both of which really describe the pain of myocardial infarction well. Now, in the other thing that you've put, Jen, excellent. You've listed the elements of ECG complex for sinus rhythm. You've spoken about right axis and left axis deviation, ventricular hypertrophy, and hemodynamics. You've done a good analysis there of central venous pressure measurements, and you've spoken about arterial lines. My understanding these days is that if in heart surgery a patient needs a Swan-Ganz catheter, then you have to send a letter to NICE to explain why it is that you need it. When I was in intensive care many years ago, Swan-Ganz catheters were more or less universal. More or less universal. But nowadays, much more rarely done. And what's more, when I was in practice, Swan-Ganz catheters really answered the problem. People used to come out with pulmonary edema froth coming up their ET tubes after heart surgery, and the Swan-Ganz catheter more or less abolished that. I noticed that you don't use continuous cardiac output up there in Aberdeen. That must be because you're behind the times. Only joking, Jen. Only joking. Don't get on the phone to me. Only seen a Swan-Ganz catheter in a couple of years in coronary care. You also mentioned that you don't use continuous cardiac output readings, and from what I read here, it almost seems as though you're talking about a Swan-Ganz pulmonary occlusion catheter. That's not really what I meant. What I meant was the new sort of thermodilution techniques such as PICO. So my guess is that if you haven't mentioned it here, then you're not really using it. And this kind of underlines a difference between coronary care nursing and intensive care nursing, doesn't it? PICO lines very common in intensive care units, rather taking the place of pulmonary artery catheters in intensive care units, which is partly because in intensive care units you're looking for an excuse to put any new type of monitoring device in. Whereas in coronary care units, on the other hand, the message is far more, let the patient relax, hands off, let nature take its course. Yes, like the remarks you've made there about exercise testing, Jen. Yes, excellent. And I'm sorry if these lessons lack a certain balance. Some weeks there's a lot of work, some weeks there's next to work. I will have to really get down and tidy that up in the future. What I am thinking of doing is getting the exercises off the PowerPoint slides and making them separate. But that's for me for the future. Anyway, I hope all you lot are thoroughly shamed into getting a bit more correspondence to your loving teacher, and rather hate sat here at the bar talking to myself, well, me and Jen having a private chat to ourselves. But nevertheless, keep up the good work, coronary care, and I'll speak to you next week. Bye now. Let me just turn this off before I make a complete